All right, let's dive into this. I was looking through the material, and what immediately jumped out was just how completely the patient journey has transformed.
Oh, absolutely. It's really night and day compared to even, say, a decade or two ago.
Right. It's not just about, finding a dentist anymore. It used to be a referral, maybe the yellow pages. Pretty simple.
Yeah, very straightforward back then.
But today, if you've got a toothache, maybe you're thinking about some cosmetic work, your first stop is probably online.
Google, social media, reading articles.
Yeah.
People are actively looking for answers,
They want trust. They want expertise before they even think about picking up the phone.
which means for dental practices, just having a basic website, no, it doesn't really cut it anymore.
Not at all. You need to be providing real value, educating patients.
And really positioning your practice as that trusted authority online.
Exactly. But that brings up a practical challenge, doesn't it?
A huge one. Think about it from the dentist's perspective. Consistently creating really high quality content.
Like blog posts explaining common issues or maybe videos.
Engaging videos, yeah. Or those detailed SEO-driven articles on complex procedures. It takes time.
A lot of time. And they're managing a busy clinic, patient care.
Who really wants to sit down and write a detailed blog post after, a long day of
It
procedures?
feels overwhelming, I imagine.
Totally. So the big questions become, how do you find the time? How do you make sure the content is actually, engaging?
And crucially, does it actually bring new patients in? Does it work?
That's the bottom line, isn't it?
You've really hit on the core challenge. It's about time, and it's about expertise in marketing, not just dentistry.
Yeah.
So, okay, how are successful dentists navigating this information-driven world?
Well, that's where this idea of content marketing for dentists comes in.
And it's not just a buzzword, right?
Yeah.
Our sources suggest it's a genuinely powerful, sustainable strategy.
Exactly. And we saw mentions of services like Marketing 360, that platform designed to help practices specifically with this.
Right, helping them attract, educate, and importantly, retain patients using this strategic content approach.
And if you connect that to the bigger picture, strategic content marketing does a few key things really well.
Okay, like what?
First, yeah, it positions the practice as a trusted authority. That's clear.
Builds credibility.
But it also digs a bit deeper. It addresses those unspoken patient anxieties.
That's interesting. So someone's searching about, say, gummy smile treatment cost.
They're not just looking for a price tag. They might be nervous, worried about pain, recovery time.
Makes sense.
Content that tackles those fears directly.
Yeah.
That builds massive trust, often before they even speak to anyone at the practice.
So it's engaging potential patients by answering questions they might not even ask out loud yet.
Precisely. By the time they do call, they already feel like they kind of know you, they trust you.
And the third thing, you mentioned search rankings.
Yeah, and this is crucial, especially locally. Good content significantly improves your visibility on Google.
Through things like local SEO, geo-targeted keywords.
Spot on. Making sure people in your specific area find your helpful content when they search for dental topics.
So you're discovered right at that moment they actually need help.
That critical moment of need, exactly.
Okay, that lines up. But I can still hear some dentists thinking, well, online stuff feels impersonal. Referrals are still king.
And referrals are incredibly valuable, no doubt. Direct referrals are gold.
But
But strategic content actually enhances those referrals. Think about it. Someone gets referred to Dr. Smith. What's the next step?
they Google her, look her up online.
Right. And if her online content, her articles, her FAQs, reinforces her expertise, maybe shows her personality a bit?
That initial trust from the referral just gets amplified.
Exactly. Validates the recommendation.
So is there a specific type of content that works best? Video testimonials, detailed articles.
Video's definitely growing, but for dentists, often those really specific FAQ pages or blog posts.
The ones that directly answer patient fears about pain, cost, how long a treatment lasts.
Yes. Those often convert better initially than, say, a generic About Us video, because you're meeting them right at their point of anxiety.
Meeting their immediate need.
And here's maybe an overlooked insight from the materials. It's not just about attracting new patients.
Oh.
A real long-term win is using content to educate and retain your existing patients. Keep them informed, keep them engaged.
Which leads to higher lifetime value for each patient. That makes business sense.
Absolutely.
So, wrapping this up, what's the main takeaway for a dentist listening to this?
Well, it really means that having experts, maybe an agency or a platform, manage that intensive content creation frees you up.
Allows the dental professionals to focus purely on the clinical side, on providing exceptional care.
Right. And meanwhile, the content is working 257 in the background.
Working to attract, but also to educate and almost pre-qualify future patients.
Exactly. Growing the practice, building his reputation, and often attracting the kind of patients you want.
Establishing the practice as a leader.
Which brings us to a final thought, maybe for you, the listener.
Yeah.
Just think about your own habits for a second. When you research any service, or maybe a health topic online, what do you do? What kinds of questions do you type into Google? Are you looking just for reviews? Or do you dive into articles that answer your specific worries?
Probably the articles that answer my immediate questions, yeah.
See, that experience right there shows exactly how this kind of content marketing works. It builds rapport, builds trust.
It's often before that potential patient even makes the first call.
It fundamentally changes how practices acquire patients. It's about being helpful first.
Helpful first, dental practice second. I like that. Lots to think about there.